References to syphilis, a sexually transmitted infection caused by bacteria, can be found in historical documents dating back hundreds of years. There was a lot of shame and stigma attached to the disease, as it was sexually acquired and had serious and often deadly health consequences. And there was no cure.
Today, syphilis can be cured quickly and effectively with antibiotics. However, many people don't know about the risks of syphilis. Think about it as a disease of the past, or continue to feel shame around sexually transmitted diseases, preventing them from getting help.
If syphilis is not treated, it develops in stages. The first stage, called primary syphilis, usually occurs 3 weeks after infection, and symptoms can include painless sores. Secondary syphilis can occur 2 to 12 weeks after sores develop, and a rash is most commonly seen with some other symptoms. The third stage is the latent stage, and though there are no visible symptoms, the bacteria remain in the body and can eventually cause damage to the organs, blood vessels, and brain. Over the past decade, across Ontario and Middlesex-London, all stages of syphilis are rising significantly. Women are also becoming increasingly affected. Infants born to mothers with untreated syphilis can contract congenital syphilis, which is a life-threatening condition. Those using substances, experiencing homelessness, and working in the sex trade are most at risk.
In response to the rise in cases in our community, MLHU formed a working group to develop a strategy and encourage syphilis testing and treatment in women between the ages of 18 and 39, provide education, address stigma, and raise awareness around the risks of not treating the infection. This strategy was titled, "Syphilis is on the Rise. Don't guess, just test."
We knew there was no single approach to a campaign like this. We needed to reach out broadly to women of reproductive age and their healthcare providers, but we needed a different approach for women most at risk. We used social media advertising, bus shelters, our website, magazine ads, and local media to encourage women to talk to their healthcare providers. But we couldn't count on those tools alone.
There are a lot of community partners working with at-risk women. We provide these partner organizations with items such as posters, wallet cards, and promotional items with our contact information. We also provide toolkits with facts about syphilis, testing and treatment information, and conversation guides. We know from our previous work that it is easier and more effective to have these difficult and sensitive conversations with a service provider you already know and trust.
Every day, Middlesex-London Health Unit outreach workers connect with community members facing barriers to healthcare access. Some sleep rough, use the local shelter system, or they couch surf. Their health may be further impacted by mental health conditions or substance use. They may not have access to mobile phones or access to computers. Our goal here is to provide accessible, non-judgmental access to information and harm reduction supplies, as well as to facilitate access to local health and social services. During these interactions, we also raise the issue of the rising rates of syphilis and the ease of testing and treatment, both of which are free through our sexual health clinic. As the treatment involves 3 doses of antibiotics over 3 weeks, we also support follow-up care, helping our clients get the best treatment results.
Overall, our strategy helped us reach thousands of people across our community through social media, digital advertising, service provider engagement, and in-person contact. We saw strong engagement with our inclusive, stigma-reducing messages, and the feedback we received helped us better understand what resonates with our community. These learnings have shaped how we think about future sexual health promotion and continue to inform our work as opportunities arise.